Hey strong and senior family, and especially to all of you incredible seniors out there. Every year, millions of you do the right thing. You go in for your routine checkups. You trust your doctors, you follow their advice, and you should. But what if I told you some of these very tests, the ones meant to keep you safe, might actually be increasing your risk of stroke overnight? Sounds impossible, right? You're thinking, my doctor would tell me. Well, that's precisely the problem. Buried in the fine print of modern medicine are silent risks, ones that often go unmentioned. Not by the news, not in clinic brochures, and sometimes, even your doctor might not highlight them. Imagine this. You walk out of your annual checkup feeling great, thinking you're in the clear. Then, just days later, dizziness, blurred vision, or something far worse hits you. You're left confused, wondering, what just happened? Here's the stark truth. Certain diagnostic tests, especially if done too often or without considering your specific health conditions, can quietly trigger sudden spikes in blood pressure, disrupt critical blood flow, and even set off a chain reaction that could lead to a stroke. Now, this isn't about fear. This is about empowerment. It's about giving you the knowledge to ask the right questions to protect yourself and your loved ones. Because after 60, it's not just about catching problems early. It's about shrewdly avoiding the ones we might accidentally cause. In the next few minutes, we're going to pull back the curtain on 5 common medical tests that carry hidden stroke risks, especially for seniors. And more importantly, you'll learn exactly how to protect yourself before your next appointment. If you're over 60, drop a 1 in the comments. If not, drop a 0, and make sure you're subscribed to Strong and Senior, because we uncover what others won't tell you. Now, let's talk about the first test you absolutely need to think twice about. Test number 1. The CT scan with... This isn't to say CT scans with contrast are inherently bad. Far from it. They detect cancers, blood clots, aneurysms, life-saving information. But the key takeaway for you, a senior, is this. These scans must be used wisely, not just ordered as part of a routine, just-in-case checklist. So, what can you do to protect yourself? Before agreeing to a CT scan with contrast, look your doctor in the eye and ask, is this scan absolutely essential, or is there a safer option for someone my age and condition? Share your complete medical history, especially if you have high blood pressure, kidney disease, heart conditions, previous reactions to contrast, or are on any medications. And always ask, can we do this without contrast? Often, a non-contrast CT or an ultrasound can provide enough detail without the added risk. You have that right. Test number 2. The stress test. Pushing your heart too hard? Next up, a common screening many seniors get, even when they feel perfectly fine. The stress test, also known as the exercise stress test. On paper, it sounds logical. Put on a heart monitor, walk on a treadmill, and see how your heart handles pressure. But if you're over 60, especially with high blood pressure or existing heart conditions, this seemingly simple test could turn genuinely risky. Here's why. During the test, you're pushed to walk or even jog on a treadmill while your heart is meticulously monitored. As the speed and incline increase, your heart rate skyrockets, your blood pressure surges, and your cardiovascular system is suddenly under intense artificial strain. For a healthy 30-year-old, this might be fine. But for seniors, particularly those with pre-existing conditions, it can be like lighting a match near dry tinder, potentially igniting serious complications. Some of the very real risks include dangerous spikes in blood pressure, sudden arrhythmias, irregular heartbeats, and in rare but terrifying cases, small tears in fragile blood vessels, especially in the brain. A 2020 study in the American Journal of Cardiology scrutinized over 1,300 patients above age 65 who underwent treadmill stress tests. The results were concerning. Nearly 7% experienced harmful events during the test, including alarming blood pressure surges and abnormal heart rhythms. And the most affected group? Those who already had existing vascular issues. This isn't just medical theory, it's real life. Margaret from Ohio, a loyal, strong, and senior viewer, shared her story. At 74, with years of high blood pressure, her doctor recommended a stress test just to check in. Halfway through the treadmill portion, she felt dizzy and experienced tightness in her chest. They stopped the test immediately, but by the next day, she suffered a minor stroke. Doctors concluded a sudden rise in her blood pressure during the test likely ruptured a tiny vessel in her brain. To be crystal clear, the test itself didn't directly cause the stroke, but it introduced an acute, intense stress to an already vulnerable system, and that's what tipped the scale. So what's the critical takeaway? Talk to your doctor assertively. Ask, is there a safer way to evaluate my heart? In many cases, a nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram, may be far safer alternatives for seniors. And if you're currently experiencing no symptoms whatsoever, no chest pain, no shortness of breath, no unusual fatigue, question whether the test is truly necessary right now, or if it can safely wait. Your well-being is paramount. Test number 3, the endoscopy with sedation, a silent blood pressure culprit. Let's move to something that's become incredibly routine, especially after 60, the endoscopy. Whether it's to peek into your esophagus, your stomach, or your colon, doctors frequently recommend it just to be safe. And sometimes, yes, that makes perfect sense. But here's the critical information no one tells you. If you don't truly need it, and especially if it involves sedation, it might do more harm than good. First off, most people over 60 are on some form of medication. Blood thinners like warfarin, aspirin, or Plavix are extremely common. And when you're sedated for an endoscopy, your blood pressure and circulation naturally shift. Combine that with medications that directly impact your blood's ability to clot, and suddenly, you're facing a higher risk for internal bleeding or, even more concerning, compromised brain circulation that can trigger a silent stroke. In 2021, a large-scale review published in the journal Gastrointestinal Endoscopy revealed a sobering finding. Among patients over 65 who underwent sedated endoscopy procedures, there was a significant increase in transient ischemic attacks, TIAs, also known as mini-strokes, within the following 72 hours. These weren't necessarily major strokes, but they were undeniable warning signs that something had gone awry in the brain's blood flow. One case that profoundly impacted me involved a 76-year-old woman. She had a routine colonoscopy with sedation. She had zero symptoms going in, but 2 days later, she began slurring her speech and lost coordination. The ER confirmed she had experienced a mild stroke. The doctors believe the drop in blood pressure during sedation, coupled with her daily aspirin use, may have created the perfect storm for a clot to travel. Even if the procedure itself is inherently low risk, the potent combination of sedation, age, and existing medications can create a perfect storm. Now, this doesn't mean you should avoid all endoscopies, but it absolutely means do not agree to one unless your doctor can provide a crystal clear explanation of why you need it right now. If you're simply getting it because it's been a few years, ask if there's a safer way to monitor your condition, especially if you have no symptoms. Always remind your doctor about every medication you're on. Ask them directly, will I need to stop my blood thinner before this? What are the specific risks of sedation for someone exactly like me? And if you're uncomfortable with sedation, ask if the procedure can be done without it or with lighter options. Your comfort and your safety matter. Test number 4, the MRI with contrast. Your kidneys and brain at risk? MRIs are undeniably powerful tools. They give doctors an unparalleled view deep into your body, helping to spot early signs of trouble and sometimes even prevent unnecessary surgeries. But when a contrast dye is added, usually to achieve even clearer images, that's when extreme caution is needed, especially for older adults, and particularly for those with even mild, undiagnosed kidney problems. The contrast dye used in MRIs often contains gadolinium, a heavy metal. In a healthy system, it's meant to be flushed out by your kidneys. But here's the critical catch. After 60, kidney function naturally gradually slows down. And if you already have chronic kidney disease or reduced function that hasn't been diagnosed yet, your body may not eliminate the gadolinium effectively. Over time, small amounts can linger, and that lingering can be dangerous. Gadolinium retention has been linked to a rare but severe condition called nephrogenic systemic fibrosis, NSF, which causes hardening and thickening of the skin and connective tissues. In the worst cases, it can severely limit movement, breathing, and even lead to organ complications. But here's the part most people don't hear about. Retained gadolinium has also been found in brain tissue. Researchers believe it may cause subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people already at risk for circulatory issues. A study published in Radiology in 2019 tracked over 2,000 patients over 65 who received contrast MRIs. Within a week of the procedure, about 5% reported stroke-like symptoms, headaches, blurred vision, balance problems. These weren't full-blown strokes. They were glaring red flags. Most of these patients also had underlying kidney issues, whether diagnosed or not. Harold, 79-year-old veteran Arizona, went in for an MRI after struggling with persistent back pain. His doctor ordered it with contrast, just to be thorough. Harold had no idea his kidneys were weakened. After the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. It wasn't until his primary care doctor ran labs that they discovered stage 3 kidney disease. No one warned me, he told us. Had I known, I would have asked more questions. Here's what you must do. If your doctor runs a contrast MRI, directly. Can we do without the contrast? Often, the answer is yes. If test is truly indispensable, kidney function test first. Simple blood test called a GFR, and it can give both you and your doctor immense peace of mind. Also, make sure they know if you've had any strange reactions to imaging tests in the past. The MRI itself isn't the villain. It's the extra chemical your body may not be able to well. With the right precautions, you can still get the answer you need without putting your brain or kidneys at unnecessary risk. Test number 5. The routine carotid artery ultrasound, leading to unnecessary surgery? Next, let's turn our attention to a test that seems utterly harmless, even smart to do regularly, but it may be steering older adults toward risky surgeries they never actually needed. I'm talking about the routine carotid artery ultrasound. It's non-invasive, takes just a few minutes, and doesn't involve any needles, dyes, or loud machines. Sounds like the perfect preventive test, right? But here's the crucial detail most people over 60 don't know. If you have no symptoms and your doctor is just ordering this scan to check, this simple test might lead you down a path to surgery you never, ever needed in the first place. The carotid arteries are the main blood vessels that deliver blood to your brain. Over time, like many vessels in the body, they can develop plaque, those little buildups of cholesterol or calcium. That's normal, especially as we age. But here's the kicker. Not every bit of plaque needs to be removed. In fact, in many cases, it's far safer to simply monitor it than to undergo an operation. Here's where things can go terribly wrong. Let's say you get the test, and it shows some narrowing in the artery, maybe 50% or even 60%. That sounds terrifying, right? So your doctor refers you to a vascular surgeon, and suddenly, you're being told you should consider a procedure like a carotid endarterectomy or a stent. But here's the pivotal point. If you had no symptoms whatsoever, no dizziness, no vision changes, no weakness, these procedures might offer very little benefit, and they carry very real risks. In fact, a major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that in many cases, surgery did not reduce stroke risk significantly more than medication and lifestyle changes. And more troubling, a small percentage of patients who underwent surgery actually experienced strokes as a direct result of the procedure, either during surgery or in recovery. One story that truly hits home comes from Helen, 82, from Pennsylvania. She went in for a checkup, felt perfectly fine, and had a carotid ultrasound because her doctor just wanted to be thorough. It showed 65% narrowing. Within weeks, she was sent for surgery. Sadly, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us, with heartbreaking regret, "I wish I'd known that doing nothing might have been safer." So what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, be assertive. Ask, what exactly are we looking for? And what happens if we find it? Make absolutely sure you understand whether the scan is truly likely to change your treatment or if it will simply cause unnecessary worry and push you toward invasive procedures. If you're already on blood pressure medications, cholesterol drugs, and living a healthy lifestyle, an extra test may not change much. And if you've already had a scan that showed some narrowing, do not panic. Ask about repeat scans instead of rushing to surgery. And always, always get a second opinion before undergoing any vascular procedure. Your brain's safety is worth it. Your health, your power, a final word. Let's wrap this up with some warm advice and a powerful reminder. Your health is in your hands. Here's the undeniable bottom line. Not every test is dangerous, but not every test is necessary either, especially after 60. Our bodies respond differently as we age. What seems routine, a contrast dye, a sedative, a simple scan, can have ripple effects we don't always see coming. A simple injection might spike your blood pressure. A scan might trigger an unexpected reaction. Even a quick checkup can carry risks if your system is already vulnerable. That's why it is so profoundly important to pause, ask questions, and make absolutely sure every test aligns with your individual health needs, not just a generic checklist or protocol. You have every right to speak up, to ask, is this truly essential for me? To say, can we explore a safer alternative? Because informed decisions lead to better outcomes, to greater peace of mind, and ultimately, to a healthier, more vibrant life. Your health story matters. Your voice matters. And here at Strong and Senior, we believe every single choice you make about your well-being should be guided by knowledge, not fear, and certainly not just habit. If you've ever felt strange after a scan or test, or watched a loved one go through something unexpected, drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. And if this video helped you feel a little more aware, more in control, or just more curious, hit that subscribe button for Strong and Senior. We're here to uncover the truth, ask the hard questions, and always put your well-being first. Stay strong, stay informed.